Far before we had a permanent clinic, we led many mission trips into Haiti. In fact, one of the people who led some of those trips is Jody Ellingson, our Director of Partner Relationships. Jody, thanks for being here today.
Yeah, it's great to see you.
Now, one of the very first stories I remember you telling me right after I started was an incredible story that happened about a little girl who was involved in an accident. Can you share that?
Yes, I witnessed something that I'll never forget. I was down on a mission trip. I was in the courtyard, and the team was out at the school. And we have outside of our campus, there is a dirt road with rocks, dirt, everything on it. We have, that day, I was standing there and I heard a screeching noise. I heard a scream. I heard a couple of mumblings in Creole, and I saw our security guard run out of the gate. A few seconds later, he came running in, holding a teenage girl from our high school, limp in his arms. So I ran over to the medical clinic thinking maybe I could help. So I went to the supply cabinet. I was getting all the gauze bandages out and went over, and I heard Nurse Berlin praying over this little girl laying on the floor. And I walked over to see her, and I thought, I went to the medical clinic and she went to prayer to God.
Wow. That is incredible. That moment, it still gives me chills because it shows the difference. In Haiti, faith isn't added to medicine. It's the foundation. And especially when resources are limited. And one of those doctors who lives that every single day is Dr. Diami. You're about to step into her world. You're going to hear the challenges she faces, not occasionally, but every single day. Let me introduce you to Dr. Diami.
I am Dr. Jami Saint-Just. I am the doctor that is working here at the clinic in Léogâne. We see everyone here, from the oldest person to the youngest person to our youth. We see people with hypertension, H. pylori, malaria, typhoid, skin infections, and many, many different infections. The list goes on. If someone needs lab tests, we send them to the closest possible lab if it's available. Then, if they do return with result, we give them some prescription, but so most of the time they don't return. We see 28 to 30 people per day, and sometimes even more, but that is our normal schedule. The biggest difficulty that we face every day is that we don't have enough supplies or tools. There are many times we want to provide the bigger services, but we are limited. We are limited with the tools and the supplies. At times we look at our patients, they are suffering, they need our help, but we can only work within our limits and what we have available. But what we are facing is lack of supplies. One of the biggest difficulty without a lab here is that we have to send our children far away, but the cost is so high and expensive, and the kids aren't able to complete their lab work and provide us with the results. And many times their care have deteriorated, and without the result of this lab, we cannot provide the services. And many times we send them with the paperwork and the documents that they need, paperwork for the lab work. They will return and tell us they've lost it and everything is so expensive we couldn't do the work. Now this medical emergency has gotten worse. When there is a delay in the result, many times for these children, as a doctor, you don't want to lose hope, but their situation gets worse. As a result, you can't just give them an empty diagnostic. You need the result. Many chances when we take all this time and they don't get their lab result, the child could die. What service that I receive is that I had an unbearable stomach ache. We didn't have a lab here that can provide the services that I need. They provided me with medications for the stomach ache that I had, and I took them, so I believe that they are okay for the services. I had a typhoid and malaria. I saw the doctor, and she sent me to go get a lab work, and I went and did it, and the lab results were positive. Once the results came back, she gave me medications and prescription. I follow her guidance, even though there was still some tracing of the malaria. However, I have received some great services and positive results of the services that I receive. When a child comes here and they are malnourished, it affects them in every category, even their capacity to learn in school. Now, when you think when they are malnourished and they need health emergency reaction, they have a weak immune system. Their body does not respond properly to the medication that they need. It is not effective. It takes much longer for them to heal. It is so much different from someone who is actually in good health. So malnutrition is one of our biggest problems here in Léogâne. The way we educate the patients, the kids, on nutrition and health services, every single one of our patients, they get a one-on-one conversation with us. We do an intake. We talk about what kind of water they should drink, sanitary action, nutrition, what is healthy, how do you eat. Every single patient gets counseling before they leave. This is the only way we can affect change here in a community in Léogâne. What motivates me every day to come here and work every day? Well, there are many reasons. When I come here, I feel like I am at home. I'm relaxed. I'm at peace. The patients respect and love what I do. They show so much gratitude for our service. When a patient lives here, she comes back and said, thank you very much for the medication and the service you provide me. I feel good. I bring others who need help. I talk about the clinic and the services they provide. That is the source of my motivation every day.
She shows such strength, commitment, and faith. And yet, there are limits when symptoms aren't obvious and when treatment doesn't work as expected. Without an on-site lab, samples have to be sent away, and waiting costs time. And in medicine, time matters. So, what if we could change that? What if instead of sending samples away or sending families into unsafe areas, we could test right here? Let me show you something.
Welcome to our space. As you can see, we have started installing the countertops because this is where we are building our laboratory. This area right here is where we will receive our patients. Our receptionists will be stationed here. It is absolutely beautiful. It's a great, decent sized space for our lab. In this lab, we will run tests, a lot of different tests. The common cases that we see here, we see malaria, typhoid, H. pylori, diabetes, hypertension, pregnancy, so many exams that we'll be conducting. All of these will be able to be taken care of here in our town. What changes will this bring to our community? Well, having a lab available locally will increase the quality of service we provide. We won't need to send our patients to outside locations, out of the community. Many times, they don't return when they go elsewhere. Oftentimes, it's difficult for them. A lot of issues with funding, and it prevents them from coming back. But if it's here, we can teach them, we can take care of them here, and they get better service faster. Many times when they go to other areas, it costs so much for them to receive these lab work, and many times they don't return back to us. But if we have it here locally, it will allow us to get the results faster. It allows us to help them in terms of cost association because it's less expensive for them. And here, we will take care of them in Leogane, our area. We want to say thank you to all of our sponsors. The work that they are doing, the support for Haiti, the support of our clinic here and our community here in Leogane, our Haitian community. There are a lot of diseases and sickness, but we are here to combat that and prevent some of them as much as we can. And it doesn't cost them much to get the services.
This is a real space we already own. With the right equipment and a lab technician, this room becomes faster diagnoses, earlier treatment, and better outcomes. Now, tools don't replace faith. They strengthen what our doctors are already doing. And to help explain why this matters medically, we asked Dr. Peter Daly, founder of One World Surgery and Mayo Clinic Humanitarian Award recipient, to share what he's seen around the world. Now, Dr. Daly has served in communities around the world and is described as a true servant, filled with kindness, humility, and compassion. He's known and described as a dreamer and a doer, and we're blessed to have him with us today. Thank you so much for being here.
Thank you for having me.
Yes. Well, why don't you start by just telling us a little bit about yourself and give us a little bit of your background?
Well, for my occupation, I'm an orthopedic surgeon. I practice principally in St. Paul, Minneapolis. And I'm married, I have 4 children, several grandchildren, and God willing, more to come. But I've been interested in global health throughout my career, and I've always wanted to incorporate my family involvement with that. So as I went through the 1990s and volunteered at some different organizations, I just couldn't have my family involvement with me as well. And it was important for me to do things such as a service trip with my family to teach my kids that they can see, their mom and dad serving, and they can create that example to carry that into their adult life as they've done. But it's allowed me to see also, as we started our own surgical facility in Honduras in the early 2000s, what are some of the barriers to getting a facility equipped and running, and through some of the other difficulties and side services that are needed to run a healthcare facility. And that's why I was particularly interested in talking with you about some of your goals as you're attempting to also serve some needs globally.
Thank you for that. So you obviously saw this when you were in Honduras, and I know that you've served in places like Haiti as well. What happens when you go into a place where children and frankly, even adults don't have easy access to medical care or to appropriate diagnostic testing?
Yes. Well, what happens is if they don't have the access, they simply don't get the care. And when you have something that is initially a fairly simple situation, in my world of orthopedics, we take care of a lot of fractures, of course. And it may be a very simple fracture that could be easily aligned in a cast and treated non-surgically. And when that's delayed and it becomes a malunion or heals in a crooked direction, that becomes a very complex problem that requires more of a big intervention to correct the deformities and the disability associated with it. And the same could go with all kinds of medical topics, hypertension, or things that are unaccounted for wind up with a stroke, or a child with a small infection. If that gets an abscess, then all of a sudden they've got a mechanical pressure on their brain or on another part of their body that can be very disabling. So
I'm sure that you probably even saw some of that, where a patient would come in and you were like, oh, if we would have just seen this sooner. Can you think of a case where that happened and where you thought, if only this, then we wouldn't be here today?
Oh, certainly. Well, the most obvious case was this 9-year-old girl that had a growth plate deformity that was just unrecognized, and once recognized was untreated for several years. So by the time she became 9, she was had so many deformities and things that it wouldn't be solved with monitoring the growth plate or modifying the growth plates of the affected parts of her lower extremities in this situation, and her upper extremities. And then it required more of a major surgery. And the experience that I had was that she came, we realized that she couldn't get the care in Honduras, and she came and lived with us for a year in Minnesota and got a lot of care through a lot of generous situations. And for her growth plate abnormality had already progressed by her age 9 to have her in a wheelchair. I mean, she simply couldn't walk. She couldn't run. And the public shunning of an individual that disabled in those kind of cultures, there's just no future for them. Her employment future would be markedly limited, and just her spirit of what she felt like she could do. So it was time to intervene, and it required a much bigger intervention, of course. That's one person and one patient, and it had a profound effect on myself and my family, and hence we really, after that, we were all in on global health. But so just as Haiti Empowered is trying to build the infrastructure, the facility to handle the things in their environment there, you can't bring every child out of Haiti to get their care. And so to build that infrastructure is so important. And that's what prompted me to say, well, gosh, we have to find a facility or build one to handle some of these solutions or propose these solutions in country. And that's what's so unique about global health. It's really empowering the people in that country with the skills from the riches that we have in our high-income country of the United States.
Now, many of the children and adults that we serve are already vulnerable. They may be dealing with other types of diseases, and then they, that's kind of underlying, and then they come in and they've had, a fracture, a break, or something else. How do all of those things work together that changes the equation when they get sick with something else?
Yeah, it compounds it, and it complicates the situation, of course. I mean, patients that are malnourished don't heal as well. They have a higher incidence of infection when they're malnourished. They can't fight off the infections. They just don't have the energy to overcome them. And that's worse also on the two extremes of life, the very young, the infants and patients under the age of 5, and then certainly those that are very elderly. And so both the elderly and the very young children can get sick very quickly. Children, different from elderly, can get better very quickly also. And so they're amazingly resilient, but you have to try to help them within that window of time to let them bounce back without permanent sequelae. Particularly with nutrition. If you have a child that doesn't get adequate nutrition in that first 2 to 3 years of life, they can have some significant intellectual and learning disabilities. So that nutritional exposure before age 3 is uniquely important to not disable them or handicap them in their learning abilities going forward.
You have had the unique ability to go in and see a lot in these other countries. What do you wish people really understood who haven't been confronted or who haven't seen it in person?
Yes. There's nothing better than seeing And I know Haiti's got such a desperate security situation that you can't really go visit there. But even the power of, these videos, or as I know we've talked about the virtual visits that your organization is working with, can be very powerful because it can really illustrate and give them an idea of what life is like for 90% of the world. And we just are in such a bubble, in our environment, and we're called to be aware of what's going on globally. And it's just, I think it's just a moral necessity to open your eyes and have some idea of the Lazarus that's outside your door that we're stepping over, as we know from that gospel story. And the person in that Lazarus story didn't do anything wrong. They probably were donating to the Save the Bird Foundation or whatever great thing, and they took care of their yard perfectly, but it didn't end well for that person in that gospel story because they just didn't see what was right in front of them. And we have so many opportunities to see what's in front of us. If we can't get there by an experience, we can at least be aware of it through some of this education you all are providing.
That's great. So if you could speak directly to the people watching here tonight, how would you explain the importance of appropriate diagnostic tools?
Well, it's critically important. If you don't know what you have, you can't treat it. And so many people in Haiti, I'm certain, die of something and they never even got a diagnosis. So the first piece of the puzzle is to evaluate the patient, your clinic, your health setup that you've established with the doctor and the dentist and things. At least they can identify what the diagnosis is, and I'm sure their clinical skills are amazing. They don't rely on MRIs to make a diagnosis. They examine the patient, take a history, and they know their environment. So I'm anticipating that they understand diagnoses there for the most part, but to really provide the treatment, they do need some diagnostic tools, and labs are a critical part of it. Imaging is also important, of course. And once they can get those other pieces of the puzzle for information, they can come up with an appropriate plan to help care for those people. So I would add that you've identified some things that are necessary. And if you can at least start out with doing what's necessary, and then the next step is doing what's possible, and maybe that's some of the lab and diagnostic equipment. And then the next thing you'll find with God's grace is that you're doing what is impossible. Mm. And that's the multiplying factor that Haiti Empowered is probably about. And making more people aware that if we could just get those diagnostic tools in their hands of lab values and help direct them to the correct diagnosis, then the treatment is the next step. And many treatments are fairly straightforward and very available, but you need to know what you're dealing with first.
Thank you so much. I really appreciate you coming in and talking with me today and sharing your knowledge and your experience with all of us.
Well, thank you. Any way I can help a global health effort, I'm game. So thank you.
Excellent. Now, I want to be very clear. Our clinic is functioning. This is not rescuing something that's failing. It's strengthening something already working. And tonight, we're inviting medical professionals into 3 clear pathways. First, we have the Dental Collective. We're looking for 8 dentists at $4,000 per year to underwrite medications, maintenance, and personnel. 8 dentists who can say, "We've got the dentist." And then a medical collective. We're looking for 10 medical professionals at just $4,200 per year to sustain all of our clinic operations. 10 people who can say, "We've got the doctor." And then the lab initiative. To equip a new lab, $30,000. To sustain it annually, $18,600 for the technician and supplies. Now, supplies in Haiti can fluctuate, so these numbers do include margin, and over time, costs will rise. But this isn't a wish list. It's a responsible plan. And if you're in healthcare, this is your lane. And if not, you can still be a partner who helps put tools in the hands of those who are. The QR code is on your screen, and if you feel called to respond, please do so now. Now, before we close tonight, I just want to make sure that we do get all of those questions answered. So please make sure that you've written them in the chat, or you can also email us at info@HaitiEmpowered.org, and we will get back to you as soon as possible. If you're not in medicine, but you feel moved, you still matter here. Empowering doctors requires partners who fund the tools and the infrastructure. I want to thank you for caring, and I want to thank you for believing that a child's future shouldn't depend on where they're born. Now, I do want to close us in prayer. Please join me. Father, I want to thank you. I want to thank you for the people watching tonight, and for the doctors, the dentists, the nurses, the caregivers who are serving faithfully every single day. We pray for the families in Haiti who depend on this clinic. Please strengthen Dr. Diami and Dr. Dorval. Strengthen every member of the team who's serving here. Lord, provide the tools that are needed and raise up partners who will stand with this work. Raise up medical professionals who will feel called to be a part of this mission. And most of all, let every single child who walks through those clinic doors experience not only the healing for their physical body, but from the hope that comes only from you. We trust you with what comes next. In Jesus' name, amen. I want to thank you again for being with us tonight. Good night, and thank you for standing with Haiti.